COVID-19 continues to affect countries across the world, many have closed schools in an effort to curb the spread of the virus. A record number of pupils around the world have been affected by school closures, amounting to 60% of the student population. But for South Africa and other developing countries, school closures carry a high risk for marginalized girls because they're exposed to other socioeconomic issues such as sexual exploitation and teenage pregnancy while they're outside the classroom. Rahima Esop, who's the spokesperson for Zero Dropout campaign, joins me now to discuss this. Rahima, good evening, and thank you so much for your time tonight. Let's talk about COVID-19. I mean, surely this pandemic has really contributed in the dropout rate when it comes to some of the school, going girls in particular. And what risk are they facing during this time?
Good evening, and good evening to your listeners. You know, as the Zero Dropout campaign, we are concerned that the protracted school closures are going to lead to an increase in school dropout. And we know that the longer that children are outside of the school environment and lose their important attachment to schooling, the less likely they are to return, especially if that connection was tenuous or strained to begin with. And we are not only seeing the impact of the protracted school closures. Currently, learners are dealing with the twin impact of the suspension of classes as well as the economic fallout of the COVID-19 pandemic or the lockdown, which is having a negative impact on households. We've seen recent statistics showing that there's been an increase in joblessness. At least 3 million people have lost their jobs between February and April this year. And we've seen an increase in hunger. So those disruptions inside the household is definitely going to have an impact on the family as well as learners and the ability to stay in and succeed at school, especially as schools remain closed.
And there's been lots of, concerns, especially around, maintaining the number of cases, particularly among school-going children at a very low rate. At the same time, trying to keep them in school or trying to keep them and to ensure that they are learning during this time. Now, government has really found itself in a catch-22 situation where they have open schools and unions are coming out to say that they will not allow their members to continue teaching. How then do we begin to balance this, when it comes to making sure that that attachment that you talk about to school continues, but at the same time, we don't see a possibility of high dropout rates here?
We've said from the onset that the public debate should not be about whether schools should reopen. Instead, we should be talking about how civil society, educators, parents, and government can collaborate to ensure that classes resume as safely as possible and over a sustained period, so we don't have a situation where we have a stop-start scenario in terms of the school year and difficulty in completing the 2020 curriculum. You know, while the child is at home, marginalized children in particular do not have access to enrichment programs. They don't have access to meals as well as psychosocial support, which they would have been able to access had they been in the school environment. They would have been able to access counseling and mentoring. And as I mentioned previously, the disruptions as a result of the economic impact of COVID-19 will lead to a decreased or an increasing need for psychosocial services because of the strain that it's taking on all of our mental health. So those kinds of services can be accessed in the school environment, and the longer that it stays closed, vulnerable children in particular are being disadvantaged.
And let's talk about the impact it's having on child-headed households.
Well, you know, we started talking about the impact on the girl child, and we know that due to gender norms as well as gender roles, girls often have domestic responsibilities at home and have to care for sick family members as well as younger siblings, or have domestic chores that they are responsible. And this takes away their time from learning, especially now as learners are expected to learn from home while schools are closed. So that's one of the ways in which the girl child is disadvantaged and how these school closures exacerbate gender inequalities. You also mentioned exposure to sexual exploitation and teenage pregnancy in your intro. That is also a great concern because for many, school is a safe space where they can access the counsel of an educator or caring adult. And, we're also experiencing we're in the midst of a second pandemic, which is that of gender-based violence. So the girl child is in a vulnerable position outside of the classroom. These are gender-specific vulnerabilities that we need to take into consideration while schools are closed so that we can put strategies in place to prevent dropout, because we don't want to see that spike in dropout in 2020, because we're going to be feeling the impact of the school closures and this pandemic for years to come.
And let's talk about access to healthcare services, because we have been seeing that that's also, even a challenge when it comes to some of our girls, particularly in schools, because they're not even able to access family planning at this time. There's been difficulties around that. What impact is that having, particularly on issues around teenage pregnancy and even them just being able to really protect themselves?
Well, we saw in previous crises, for example, in West Africa, where they were hard hit by the Ebola crisis, there was an increase in teenage pregnancy in Sierra Leone. I think the figure is around 65%. There was a 65% increase in teenage pregnancy. So we do have experience with regards to other health crises. We know that there is increase in child labor, there's increase in teenage pregnancy, increase in exposure to sexual exploitation. And as you mentioned, with girls not having access to those kinds of services where they can get counseling, where they can get health services or access to the kind of things that they would need to be able to protect themselves, it does become especially difficult for them at this time.
Thank you so much for your time tonight. That's right.